This is how to administer a crushed medication through an NG tube. I have already checked my medication with my PCP orders, identified my patient with their identification bracelet, and checked allergies, and I've washed my hands. I need to check placement of my NG tube each and every time I access it, so I will check placement by using air bolus. I pull my syringe again back to 30, pinching my tube. I remove my cap. You can use a non-sterile drape to place on your patient just to catch any drip. I will place my stethoscope in the epigastric area and instill my air. I hear a whoosh. I will replace my cap and prepare my medication. This is my patient's medication. I have a pill crusher here. I will open the medication and place in the container. Now, I will crush my medication by putting the cap on. I'm using a twisting motion. And I've crushed it until it's in very fine particles. I will place in my medication cup, making sure that I have all of my medication, and then pouring about 30 ml of water and stirring with a straw until the medication is dissolved. Now I'm going to irrigate my nasogastric tube with water before I administer my medication. I'm going to clamp or pinch my tube and remove my cap. I'll remove the plunger from my syringe and attach to the end of my nasogastric tube. I then will pour about 30 ml of water in my syringe. And holding this higher than the patient, allow it to infuse by gravity. Once the water is to the bottom of the syringe, I will clamp my tube, and now I will pour my medication in my syringe. Now I will unclamp my NG tube and allow my medication to instill through the NG tube. As my medication is getting towards the end of, or the bottom of the syringe, I will again pinch or clamp my NG tube and fill my syringe with about 30 ml of water. This will allow all of the medication to be flushed through the NG tube and to be instilled into the patient. I will pinch my tube. I then can end this by flushing my tube with 30 ml of air to ensure that all the fluid is through and into my patient. I put the plunger back in my syringe, have reattached my syringe to the end of my NG tube, will unclamp it, and instill my air. Finally, I'll remove my syringe, replace my cap, and secure to my patient. Once I have given my patient his medication, the head of his bed should remain up at least 45 to 90 degrees for at least 30 minutes to an hour to prevent aspiration. Now I will lower the bed and put the side rail up. And I'll finish by washing my hands.